Welcome back to Pain-Free Living. My name is Dr. Andrew Gorecki, physical therapist, owner of Superior Physical Therapy, past knee pain sufferer, and knee pain expert, at least as it comes to movement. I'm a movement expert. I can help people return back to moving again pain-free. And I want to teach you today, again, we're talking about knee pain and ways to naturally relieve knee pain. That's the key. I want to help you avoid medications. I want to help you avoid injections. And I really want to help you avoid surgery. I think it's a good thing for us to want to avoid those high-risk procedures with side effects. They're expensive, time-consuming, and oftentimes they don't work out the way we want them to work out. In fact, the last statistic I was just reading in a study shows that about 20% of people that have a knee replacement are still having pain after the knee replacement. So it's not always as good as it may seem for us to just fix the things that we think are going to be fixed by surgery. Okay, so in this segment, I want to share with you a really simplified understanding of what the knee is designed to do. Okay? I've spent 16 years of my life studying how the body moves. And so that includes bones and joints and nerves and muscles and all the things and biomechanics. So I want to simplify all that and just really describe to you what the knee is designed to do. Okay? So I'm going to have some images show up on the screen here that you can actually see as I'm talking and understand what the knee is doing as I'm explaining it. So one of the rules of thumb when you look at a knee or a joint really is two bones that come together to create a space, and that space is designed for movement. So let's describe what the knee movements are. And it's important to recognize that when you have a joints in the body like to do certain movements and they don't like to do other movements. And usually what they don't do very much of is what they don't like to do. That's going to be important in a minute. So the knee, first of all, it can bend and extend. So you're familiar with that. It does a lot of that. About 140 degrees of bending and extending, okay? And that's useful when you're squatting down to the ground to tie your shoes or walking up and down stairs, anything that requires us to bend and reach down towards the ground. Our knee bends a lot. And so I would say that means that it likes to do that. It's very comfortable bending and extending. Now, the second thing the knee can do, is designed to do, is to move side to side. Now, it doesn't really matter what the name of that is, but the knee can move side to side about 15 to 20 degrees, depending on the type of person. But again, now that's much less than the knee bending and extending, right? 140 degrees versus 15 to 20 degrees. Maybe even 25 in some people. But now it doesn't like to do that as much, but it can do enough. And now the third thing the knee can do is it can rotate in and out. All right? Now it can rotate in and out, but only 5 degrees. Okay, so now that's right there. That's a red flag. That means that if it can only rotate 5 degrees, then we know that it doesn't like to do that very much. And you can think about that right now. You can just move your knee around and recognize it's pretty hard to rotate the knee, right? Now, the reason I explain what the knee is designed to do is because that leads us down the next path, which is what goes wrong with the knee. And we're going to look at that knee's ability to turn in and out. Remember, it only rotates 5 degrees. But it's important to recognize that the knee is two bones that come together. So it is the femur, which comes from the hip, and it's also the lower leg bone called the tibia, which comes from the foot and ankle. Now, it's important to recognize they can't move, they have to move together. They are interconnected. So what the lower leg bone does, the upper leg bone has to do. And that's going to be really relevant here as I describe to you when we are looking for a solution to the knee pain, we also have to recognize and be aware that the foot and ankle influence the knee, make the knee move, as well as the hip. The hip joint as well has to influence the knee. So if I've got somebody struggling with knee pain, I'm always going to look and assess how well the foot and ankle is moving and how well the hip is moving. I like to use a phrase that describes the knee as stuck in the middle with nowhere to go. It's stuck in the middle of the foot and ankle and the hip.